university's mission is to do teaching, research, and service, particularly focused in the biomedical areas. We are charged with helping people go home as healthy and safe as they came in the door. So as you might imagine, doing some of this work, we have to work with some pretty unusual stuff, infectious agents, radioactive materials, potentially hazardous chemicals, and the like. And so we have the safety program is set up and aligned around those perils so that we can focus on these areas and help these researchers and clinicians and students work safely with these materials. What's made us famous is that in the safety world, on a good day, nothing happens. So we've become very adept at being able to tell the story of prevention. So this display up here shows the data that we collect for all these different groups that tell the story at a moment's notice. What did that program do this month to make nothing happen? And all of this is woven into this academic preparation for students that are at the School of Public Health. So they get essentially pracademics, if you think about it, because we're involved in doing guest lectures. We host students for practica, for students doing their master's thesis or their a dissertation and the like. So they're really getting hands-on experience on how to manage a program. Not only do we have the activities, but it's equally important to talk about how the customers feel about the services being provided. So down below these activity reports are customer service evaluations that we complete for each unit so that we can also point to that data as well. All of that information flows down into our comparisons of our outcome data for national data there as well. And so that's what these diagrams show here. And now we're expanding our customer service roles for these our assessments for groups that we are primarily servicing, such as police, information technology, facilities and the like. And so students have been involved in all of these projects here to learn how to survey people, what data to collect, and then how do you present the data so that upper management can understand it. Part of the deal is if you come to our training, you got to give us a hat, which will speak for itself because we never marketed for this. They all came here, and that's where the real synergy is between the safety department and the School of Public Health. It's that blend together. I get a call a week from somebody at one of these universities asking if we have someone coming out of the stable. Let that one sink in for a second. Because they know not many people where they go and get academic preparation, they may know the science behind protecting someone from a chemical exposure, but they don't have the ability to collect the data on what the activities were, nor asking the feedback from the people, how they were cared for, and then how to compare it to national data. That's where the magic is. So a good example, if we just take the El Paso campus, the school is working very closely with the local municipalities for doing this novel water sampling that allows one to get ahead of the curve on the viruses that are circulating within the community. And that's been a great success story for the school, and I think it's a very powerful public health tool for all of us.